Great. Thank you so much, Dr. Sugadolski, for that introduction, and thank you to Purina for the invitation. I'm very excited to talk a lot about what I've been doing in my PhD research, which is not just using antibiotics in dogs and cats, but also using different diets or looking more at the nutrition, for example, to see what can help with modulation. But for the purpose of my talk today, I'm really going to focus on some of the effects that I've observed in cats, and then also talking about more on what could happen, especially within fiber fermentation, as we're looking about what can influence the microbiome and secondary metabolites. So I have no conflicts of interest to disclose. So jumping right in, a lot of what we've been talking about, especially between yesterday and today, is discussing the effects of nutrition. And so there's this beautiful three-way relationship between what the animal is actually consuming to what they're able to metabolize on like the host level, and then what isn't digested by the host goes into that GI or that later distal microbiome, and they can then be processed into other metabolites. But it's this really beautiful three-way relationship that kind of feeds into each other and can really affect host health overall. And so while there's many different kinds of influencers and main roles of the microbiota, the main points that I like to discuss or really emphasize is that age, diet, and health status of the animal can not only just influence the composition of that microbiota, but also the activity and what the microbes are capable of doing. And so the primary role is really breaking down and processing any of those nutrients that will bypass the host digestion. And in my lab especially, or for my research, we're talking a lot about fiber. And so that fiber will go later on and be fermented into things like short-chain fatty acids. Not just that, but also the microbiota can educate the mucosal immune system, but the primary focus of, at least where I'm looking in nutrition, is looking at the secondary production of metabolites as promoted by that nutrition source. And while there's a lot of different GI ailments or the gastrointestinal ailments, there's a lot of variation within the species, but there tend to be similar signs as what I've read throughout the literature, such as weight loss, vomiting, diarrhea, and lethargy. But first and foremost, there's a lot of talk about dysbiosis, as we've all kind of heard and become more familiar with this term. So discussing that loss of diversity, beneficial bacteria, and overall alterations to the microbiome function. And while most of the time these can be a diagnosis of elimination, there can be some confirmations through intestinal biopsies, for example, and there's a variety of intervention strategies, but kind of more so influenced by what that clinical sign or that presentation is. So kind of as a broad overview, some of the main categories, I'd say, of intervention strategies tend to be dietary related or drug related. And so while dietary intervention can be effective, oftentimes multiple trials may be required if that first diet isn't effective. Secondary, or where most of my work is kind of looking at antibiotic administration. But again, as Dr. Torreson was just talking about, that there can be antibiotic resistance, possibly long-term dysbiosis, but really affecting that host's metabolism or their abnormal nutrient metabolism ability. And the range of metro, or kind of where I'll be focusing on for my chosen antibiotic, can range anywhere between 10 to 25 milligrams per kilogram of body weight up to twice per day. And so it is a huge range, but it kind of just varies based on clinical presentation, as well as steroids or immunosuppressive interventions. And then finally, kind of more of this new area being FMTs, or these fecal microbe transplant procedures being performed in possibly either more of those severe clinical cases, or as Dr. Torreson was just discussing, possibly intervention in younger animals that may have clinical signs sooner. So as I just mentioned, I focus on metronidazole in a lot of my research, but kind of a very broad overview. It's very common in a lot of GI infections, but unfortunately there's a lot of downsides or potential negative side effects, including that of the loss of appetite, the induction of diarrhea, and loose stools that the owner is observing. Not just that, but looking on a microbial level, there tends to be significant reduction in microbial abundances, that impaired metabolism, and so I'll kind of discuss and show some more data from my research demonstrating bile acid metabolism and issues with that, as well as overall reduced fecal pH. And so the main figure I want to draw your attention to is down here on the bottom left-hand side of the screen, where in one of my first studies measuring the overall fecal scores of individual dogs by a week basis, week 4 was after 2 weeks of antibiotics dosed at 20 milligrams per kilogram of body weight twice a day. And just after 2 weeks of metronidazole, fecal scores significantly increased. So on the scale that we have, or the scale that we use, it's the induction of looser stools. So the higher the score, the looser the stool. Same as the fecal scoring system, or was similar to that of Dr. Torreson's as well. But then the two figures on the right showing alpha diversity parameters, just signifying that there's this huge reduction in overall diversity either before and after antibiotics. Which brings me to the study designs of two studies I'll be discussing today, and then I'll mention one more later on. But this study was repeated in both dogs and cats with the same timeline and the same frame, where one study was using 24 adult female beagles and the other one using 24 domestic short-haired cats. While the first 2 weeks were a baseline adaptation, the following 2 weeks induced, or I was administering a liquid compound of metronidazole to the dogs or cats twice daily with food. And then after antibiotic cessation, 4 weeks of recovery was induced, or at least observed, with fecal samples collected every single week to kind of monitor recovery. For the purpose of this presentation, I'm going to refer to them as diet A and B, just to kind of eliminate some of those biases about which diets were utilized for nutrition. So I'm going to dive into some of the dog results kind of on this slide specifically. On the left side, we have a beta diversity plot evaluating before antibiotics, as represented in green, and then red samples indicating after antibiotic administration, just signifying that before and after significantly disrupts these diversity parameters, with most of the pre-antibiotic conditions clustering together, having a very different diversity compared to post-antibiotics. But then the figure on the right demonstrates the diversity of the dogs throughout the entire study. So this would be on more of a time scale. So looking at the pre-antibiotic condition, where diversity seems to be pretty spread out among the animals here, but then after 4 weeks of antibiotics or the metronidazole, diversity was significantly reduced and was different from that by the end of the 4-month recovery. However, in our dogs, it does appear that the diversity parameters did recover to similar levels that were observed pre-antibiotics. In that same study, using the dogs as our healthy controls, or the evaluation as our model, what I really want to emphasize here is that healthy dogs that were treated with metronidazole did seem to recover a lot better and perhaps maybe even quicker, depending on what taxa or what dysbiosis index that we're looking at. So the red dashed line here represents where they started at that pre-antibiotic condition, or that week 2. Basically, the main message here is that there was some residual effects observed after the cessation of metronidazole, but most taxa did recover with some slight differences, perhaps maybe due to dietary intervention, but overall increases in Clostridium hieronymus were observed with reductions in E. coli parameters, and this was considered as a beneficial effect as they were returning to those near baseline conditions. And so now the main point of my talk today will be discussing more of what we're seeing in cats. So with that same exact study design, looking at perhaps if cats are as sensitive as dogs to antibiotics, or maybe if there's something different between the two species. So the objective was similar to this study, using a dietary intervention to see if that would help mitigate recovery in these animals. But to kind of begin, I wanted to discussing the fecal characteristics that we were observing, or that was reported during our fecal collections. And so before and after antibiotics, once more, fecal scores increased, so becoming more on that looser side, perhaps harder to pick up, especially during collections when it can be stressful. But the looking at also dry matter percentages as well, dry matter did decrease, indicating that there was an increase in fecal moisture that was being excreted by the animals. Now, evaluating some of our metabolites that were measured, we did see kind of a clear pattern with all of our primary bile acids, or these first 3 over here, showing an increase following antibiotics, whereas secondary bile acids had a significant reduction following. However, there was no overall change to bile acid production. It's just very interesting to see this very clear pattern that as soon as antibiotics are administered, there's this almost like inverse relationship, or this flip between the conversion of efficacy. Evaluating the qPCR data, I will discuss dysbiosis in just a minute, but evaluating the several key taxa that are measured on this panel, most of which did decline including our best friend, Clostridium hiranonis, or that bile acid converter, having almost little to none of a presence following antibiotics. But then Bifidobacterium and E. coli had a significant increase, which is a potential concern looking at what they could do in the long term. Now to switch gears and discuss what happened during recovery, again, same thing as I presented before with this red dashed line showing where it was prior to antibiotics. We did see an overall decrease in fecal scores, so a kind of a firming up of the stool after 4 weeks. However, fecal scores did not necessarily recover to what they originally at, but it did show signs of firming. Again, a similar pattern observed with our fecal dry matter percentages, so evaluating, or at least like looking at this figure, it does demonstrate an increase or possible moisture retention within the host, so less moisture being excreted, but again, never fully achieving that pre-antibiotic condition. Discussing more on fecal metabolites, there was an improved metabolite concentration during recovery. However, there was still a significant impairment as demonstrated, kind of looking at some of the more individualized short-chain fatty acids. So while after antibiotics were administered, there was an increase in total short-chain fatty acids, at least perhaps approaching. We did see a significant decline with time, but it could have just been a possible relapse. We're not really sure. But more strikingly than anything, it appears that propionate fermentation or propionate production was actually reduced and did not really achieve that full recovery, despite the fact that part of this dietary intervention was looking at the increase of dietary fiber in the diets. But most importantly, as I kind of mentioned before, there was this inverse relationship or this kind of flip with an increase in primary bile acids prior to or after antibiotics, we did see an improvement in that conversion rate once more with higher proportions of secondary bile acids being produced compared to our primary bile acids. But the most interesting part about really, I think, what came of this study is that in our cats, even 4 weeks after after antibiotics were completed, 80% of our cats were still considered either moderately to extremely dysbiotic by the end of the study. And that is a huge concern because even after 4 weeks, despite dietary intervention, these cats still seemed perhaps a little bit more susceptible or a little bit more sensitive to that higher dose and that prolonged 2 weeks of antibiotic treatment. So kind of a concern, especially seeing that only by the end of the study, 4 cats were considered to be normal. And a lot of this was driven by the depletion of Clostridium hiranonis or the Pepticidobacter hiranonis in, again, about 80% of those cats. And so by the end of our 8 weeks, only 5 of the 24 were actually within that established reference interval, which is, again, still a concern because this is looking at 4 weeks or a month after antibiotics were stopped. Again, also, too, the fecal scores were significantly lower and they were reduced, or they were looser, but kind of looking at an average basis, comparing all of the animals to each other, the significant drop was almost 5 times lower by the end of the study, which is a huge concern, but could also explain a lot of why we were seeing some bile acid dysmetabolism, especially on an individual basis. So taking some of these results and bringing them into possibly the next chapter or looking at more what could be done on terms of like an intervention perspective, we did see that metronidazole did induce a lot of changes to the microbiota, whether it was on a genre level, a species level. It just appears that there perhaps is some kind of disconnect between dietary intervention using fiber and this production of secondary metabolites, so short-chain fatty acids, for example. And so the next step that we decided to do was kind of look more into some of those dietary gut modifiers, or the biotics field, if you will. And while there's many different kinds of products on the market or different substrates to evaluate, where we kind of focus, or where I focus in my research lab especially, is evaluating dietary fibers. And so these are more specifically substrates that can be used by the microbes, with previous research indicating improvements in not only stool quality, but possible laxation depending on the condition of the animal. But first and foremost, it will help modulate the gut microbiota For example, providing substrates that can be safely fermented into short-chain fatty acids that can later be absorbed and used by the host, whether it's for cells or for energy. And so while there are others, like I mentioned, like probiotics and symbiotics, the main kind of focus of what I'll be discussing is using dietary fibers as a fermentation product or fermentation substrate to see what can happen in terms of recovery. Oftentimes, fibers or these biotics are prescribed in addition to antibiotics, but it's kind of to help with GI disease or enteropathy, kind of helping with symptoms perhaps, whether it's through recovery, a treatment plan, but it also can be used as a preventative to kind of help improve the microbiome in hopes that if something were to come along, like a challenge, for example, that the fiber can kind of help as a perhaps protective or preventative agent. So according to the FDA, dietary fibers are these non-digestible, soluble and insoluble fractions, including lignin, that are intact in plants. And they must have a proven beneficial physiological effect, especially in humans, as by the FDA. But these dietary fibers, and really kind of the target of using them, is to improve short-chain fatty acid production and inducing some of those positive shifts. And they've kind of been preserved or at least researched several times throughout the literature. And these shifts are showing significant improvement, especially kind of depending on the type of fiber that's used. And so these fibers comes in all different flavors, shapes, and sizes, if you will. If you look at the big picture of the different characteristics, so looking at things like the solubility, the viscosity, possible fermentability, but most importantly, I think what we're kind of looking at, especially discussing laxation or stool quality, is the fiber's water holding capacity. And kind of evaluating pet food or pet nutrition, kind of just in general, there's several different types of fibers that are used in the market, again, kind of depending on these characteristics or what is being sought out. And where I will kind of focus this next research discussion will kind of be more in the roots and pulps, if you will. So to measure some of this fiber fermentation, we use an in vitro assay using 4 adult male beagles with antibiotics, again, treated at 20 milligrams per kilogram body weight for 2 weeks, twice daily. And essentially, we pooled the samples from our pre and post antibiotic conditions and inoculated them into tubes containing 1 of 5 different substrates. 1 as a blank control, cellulose as a negative control due to non-fermentability, pectin due to as our positive control due to high fermentability, and then 2 of our test substrates, we evaluated chicory root and beet pulp. And then across the time, we did an 18-hour fermentation with aliquots collected at hours 0, 6, 12, and 18 for measurement of pH, short-chain fatty acids, and later analysis of microbiota using 16S sequencing. So to kind of dive into some of these results, overall, the pH was significantly reduced with fermentation time, as kind of expected as those microbes are given the opportunity to ferment that said substrate. And as fermentation increases and short-chain fatty acids increase, the pH tends to decline. And that was observed across all of our substrates. And for the purpose of kind of discussing some of the data here, I'm going to present our fermentable substrates, including pectin, beet pulp, and chicory pulp. And so to kind of set you up or orient you to how things are designed here, our green samples are our pre-antibiotic condition samples, and then the red were collected from our post-antibiotic treated animals. And so kind of with time, we did see, like I just mentioned, an overall decline in the fecal pH or the inoculum pH, excuse me, with antibiotics just really kind of driving a lot of the differences here. Interestingly, it seems that chicory pulp and pectin kind of had this stabilization in terms of the pH reduction, where it wasn't quite as much in our chicory pulp compared to pectin, for example, but beet pulp appeared to have very similar patterns of pH reduction. Looking at our positive control, or kind of what was expected from pectin fermentation, we had significantly increased production of acetate, propionate, and butyrate in our pre-antibiotic condition samples, so our untreated samples. And it does make sense as pectin is rapidly fermented and has extremely high productions of acetate as a result. But then evaluating our post-antibiotic treated samples, there really wasn't much of a change in overall production parameters. And so after 18 hours of fermentation, our post-antibiotic samples had shown some kind of fermentation increase, but not significantly similar to that of our pre-antibiotic conditions. Propionate, again, kind of a similar pattern where it seems like there was very minimal fermentation kind of going on, but then probably the most striking part is that butyrate production, especially in our post-antibiotic samples, just was completely diminished. So there was very, very little to basically no production of butyrate whatsoever. And that pattern kind of continues whenever we're looking at our other fermentable substrates, including beet pulp. And so as kind of a comparison, acetate and propionate production was significantly higher in our pre-antibiotic condition samples compared to our post. It did not have significantly or as high of a short-chain fatty acid production compared to that of our pectin, but it did still show signs of fermentability, especially looking at our post-antibiotic treated samples. And so there was still some signs of fermentation and some activity, so that could be considered a plus. But again, kind of observed with our butyrate production, again, very minimal, very, very low, which is a kind of a concern, like I've been saying, only just because butyrate is a very big energy source for colonocytes. So if there is little to none, and actually, if anything, there's butyrate disappearance, that's not great. Something is clearly going on, and it's not on us because we're not extracting, like we do not remove anything from the media. So butyrate production is going somewhere, if not at all down. Now, the second fermentable substrate that we tested was chicory pulp. It was fermented to a much lesser extent than that of our beet pulp, kind of evaluating the scale over here. Acetate production was maybe half of that in our chicory pulp compared to the beet pulp on the prior slide, without antibiotic necessarily helping with improvement. Antibiotics still did have an effect on overall fermentation, and still with very diminished fiber fermentation. So despite the access to a substrate, again, not really seeing much of the fermentation process happening. And again, once more, butyrate production completely lacking and declining even further than that of any other substrate that we have tested. Evaluating some of the microbial populations, or really kind of looking at diversity here, I kind of wanted to highlight that despite antibiotic treatment, or kind of factoring in antibiotic treatment, there was this very clear divide between our pre-antibiotic treated samples and our post-antibiotic treated samples, which was very interesting, kind of demonstrating that there are very different clusters kind of forming within these treatment parameters. But then also highlighting that at time zero, or evaluating these little rings between beet pulp and chicory pulp, time zero samples really did kind of cluster together, but they were also far apart. So they clustered within treatment and they clustered within time point, but they were still very scattered and very different at the beginning of fermentation. So that was a very clear indicator to us that antibiotic treatment was effective in disrupting the diversity parameters here. But then with time, we did see this increase, or this shift in overall diversity, where our hour 18 samples appear to be kind of shifting in the direction of our pre-antibiotic condition samples, or our pre-antibiotic treated samples, which was interesting. And we kind of took this as a sign of positive, or maybe perhaps a more beneficial effect, as after 18 hours, we saw kind of this pattern going back towards where our pre-antibiotic condition was. But also all of our pre-antibiotic condition samples, even with time as a factor here, diversity was kind of all clustered within the same area. It was kind of all within the same spot. It didn't really shift as much, and there really wasn't kind of this clear pattern of diversity going one way or the other. So I think kind of taking all that into consideration, in some of my final take-home messages, if you will, is that metronidazole does have some significant and long-lasting consequences. As Dr. Torreson said, the metronidazole monster, I 100% feel that, looking at especially all this data, looking at what metronidazole has actually done. But perhaps a huge limitation to all this as well is that this was all done in healthy animals, and it was done at one of those higher doses in kind of comparing all the doses observed throughout literature. But overall, from kind of all these studies, is that metronidazole dosing did impact the fecal quality and fecal consistency parameters. And so by inducing looser stools and having more moisture loss in the sample, but also evaluating some of the fecal metabolites, kind of seeing how overall production did decline, but perhaps did increase and recover with a lot of time. And this was observed through the primary bile acids increasing more than that of secondary, just kind of demonstrating that there was this impairment of conversion, but it primarily could be contributing to, especially in the cats, looking at this lack of Clostridium hirnonis. But also the fiber fermentation patterns that I kind of mentioned towards the end here were significantly altered, with very little to no butyrate production kind of being seen as possibly a point of concern, whether it's the fiber substrates that were selected aren't being used by the microbes perhaps to produce the butyrate. So kind of maybe further diving into the future to see if there's specific fiber substrates that maybe those microbes after antibiotics would have a preference to increase that butyrate production. But kind of where I really want to wrap up, especially discussing the cats, is that there was prolonged dysbiosis in majority of the cats after my trial had ended after 4 weeks of recovery. And they had significantly reduced microbial abundances still by the end and altered diversity by the end as well. We did perform a follow-up analysis on some samples collected following my trials. This was very limited, however, so kind of just using what we had. But even after 5 months looking at those samples, some of those cats were still unrecovered. I believe we had 12 follow-up samples and still lack of recovery after 5 months, but I do believe that all the samples that we're still continuing to analyze were fully recovered within a year, but we're kind of missing some time points in there as well. So there are many limitations to kind of taking some of this data and interpreting it on perhaps a more clinical scale, but this kind of shows that there's a good general direction towards personalized strategies, especially based on microbial presence. So looking more at those functional taxa that are helping to drive a lot of the metabolite production or metabolite concentrations, maybe looking more at what's there and what can be improved by nutrition or fiber supplementation, and possibly be more beneficial to overall recovery, whether it's aiding in quicker recovery time or just kind of aiding in increasing or improving the quality of that animal's life during disease or during a challenge. So finally, I just wanted to say thank you to everyone. Again, thank you to Purina for the invitation. Thank you to my advisor, Dr. Kelly Swanson. He's kind of a big deal. And I'm very grateful and very fortunate to be working in the lab that I am today and continuing to do the research in such an exciting and really invigorating field. So yeah, I'm happy to take some questions.